Hello and hi, distinguished guests, respected colleagues, and fellow researchers. It is truly an honor to be here at the third International Brain and Biomedicines Conference, IBBC 2026. Today, I'll be sharing our work on a targeted strategy that addresses a very practical and urgent challenge in influenza therapeutics, not just how we treat, but how we deliver treatment more effectively. I am Associate Professor Dr. Khuriah Abdul Hamid from Faculty of Pharmacy, University Teknologi Mara Cewangan Selangor, Puncak Alam Campus, Malaysia. All right, let's begin with the bigger picture. As shown in this slide, influenza continues to pose a significant global burden with approximately 5 million severe cases annually, which around 250,000 deaths worldwide. All right, but beyond mortality, the real impact lies in healthcare strain, hospitalization, and economic burden. So the question is not just do we have treatment, but rather are we delivering treatment effectively enough? Okay, to understand intervention, we must understand the virus. Okay, so this slide illustrates the influenza infection cycle from viral entry, replication, assembly, and release. Each stage presents a potential target. However, clinically, one step is particularly critical, which is viral release, because this is where infection spreads to neighboring cells. And this is exactly where oseltamivir acts. Based on these slides, as you can see, oseltamivir works by inhibiting neuraminidase, preventing viral release from infected cells. Mechanistically, it is effective, but effectiveness in theory is not always effectiveness in practice. Because oseltamivir to work optimally, it must reach the infection site rapidly and in sufficient concentration. And this is where current limitations begin to appear. Timing is everything. Oseltamivir is most effective when administered within 48 hours of symptom onset. Within this window, severity actually is reduced, complications also minimized, but however, outside this window, viral replication accelerates. Clinical benefit declines, resistance risk increases. So we are dealing with a narrow therapeutic window, which raises an important challenge. Can we deliver drug faster and more efficiently to the site of action? Okay. And then from this slide, we can see the systemic paradox. Oral oseltamivir, which undergoes gastrointestinal absorption, distributes systemically, but this leads to systemic toxicity, dosing inefficiencies, adherence challenges, and importantly, suboptimal concentration at the primary infection site, the respiratory tract. So, despite correct dosing, we may still be under delivering where it matters most. Okay, to bring us to a paradigm shift, instead of systemic delivery, we move towards targeted nanocarrier systems. Mm, Nanoparticles will allow us to navigate biological barriers, protect the drugs, enhance stability, and deliver locally. So this transforms drug delivery from passive distribution to precision targeting. Okay, now how we design this system, whereby we focus on surface modification for targeting, stimuli responsive release, and organelle level precision to ensure that we have the selective delivery, control release, minimal damage to healthy tissue, and in essence, actually we are engineering not only just a carrier but a smart delivery system. Okay, from this slide, we compare conventional oral delivery with intranasal nanoparticle delivery. As you can see here, for bioavailability, standard oral oseltamivir phosphate or OP, it would give delayed peak concentration due to GI transit, whereby intranasal nano OP would give rapid therapeutics concentration at the primary infection site. Okay, for side effect profile, systemic toxicity, rare neuro psychiatric events for standard oral OP, whereby for intranasal nano OP, we have localized exposure to minimize system toxicity. Dosing and resistance for standard oral OP is strict 75 milligram twice a day regimen, non-compliance drug resistance. But for this intranasal nano OP, it gives a prolonged localized retention, which lowers resistance risk. Okay, so the advantage is not just improved efficacy, but it is more rational pharmacotherapy. So our research is actually structured around three key targets, which is firstly, pharmacokinetic efficiency, secondly, barrier transport mechanisms, and thirdly, deposition efficiency in the respiratory tract. So this framework actually ensures we are not only developing a formulation, but understanding how and why it works. So our approach in this work actually to use ionic gelation, which combine chitosan for mucoadhesion properties. Okay, sodium alginate for structural integrity, which result in stable nanoparticle formation, as well as enhance mucosal interaction and improve delivery potential. So our goal is to actually maximize retention at the infection site to give the most optimum therapeutic benefit, right? So as you can see here from this slide, is actually from our preliminary data where we formulate OP with sodium alginate. Okay, where we observe the increasing that increasing homogenization improve the particle size distribution, uniformity, and stability. So the optimal condition was achieved at 3 minutes homogenization time, which is the mean particle size is 275.9 nanometer size, with low polydispicity index or PDI, which is 0.5, and stable zeta potential, which is minus 32.8. This shows the formulation within the ideal range for respiratory delivery. Okay, so the graph further supports the trend as homogenization time increases, so particle size decreases. But we did the experiment until 3 minutes, where we can see the reduce of particle size. We might prolong, but we think that the 3 minute homogenization time is sufficient because it's already give the uh, low particle size with a good PDI and good zeta potential as well. Okay. So from this preliminary data, it shows that the nanoscale optimization, where we achieve nanoscale optimization without compromising stability, which is critical for the real world application. Okay, so now moving from micro to macro impact. Okay, at the clinical level, faster action would reduce disease severity, and at the system level, it would lower healthcare burden, thereby reduce resistance, improve patient outcome. So this is not just a formulation improvement, but it is a health system improvement. Moving forward, our work continues in three directions: pharmacokinetic profiling, transport mechanism validation, and aerodynamic optimization, whereby these steps are essential to translate from bench to clinical relevance. Okay, so next slide is about, okay, so this is all the references, the key references that support the work covering influenza burden, pharmacokinetics, and antiviral strategies. That's all from me. Thank you very much for your kind attention and also for inviting me to this conference. Hope to share more with you in the next coming conference. Thank you.